38.
Right, and where do you have the pain? 'Cause you can
Mark
see your
38.
So my pain is lower left, what I know now to be like my lower lumbar. But, so it goes into the glute, down into the hamstring, kind of whips around in an S, comes down, throbs here, and now continues down to the ankle and around to the outside of my left foot,
and just one side.
just one side.
Okay, and is it? Do you have it all the time? Is it worse in the morning? Tell us the times you have it. Like, does it
It's
come and go?
constant,
Constant.
constantly 24 hours a day now.
How long have you got it?
So maybe last October, November, I felt like a twinge, thought nothing of it from, playing sports and stuff like that. I thought it was just tight hamstrings, tight glute, tried to stretch it out. Didn't improve. Then I think one morning in January I got up to, just go to the gym and come put my socks on.
Okay.
So what are we thinking of now?
That's the
Give me a nerve.
S1.
L.
Again, can you just show us again the trace of your finger?
Trace it down.
If people have a real thing, they know exactly where.
So it starts here, comes down the glute, down the hamstring. When it comes around in an S, comes down, throbs here, like a throbbing, continues like a V, down to the ankle, around to the outside.
Outside of the
Left foot.
that's most probably S1 is more on the sole and underneath the foot. L5 is usually on the outer side of the foot for now. But if a patient, so this is a very typical way of describing. How she was describing her pain was kind of diffuse.
Yeah.
Comes and goes. That's a pseudo, which is false radiculopathy. Radiculopathy is the pain or sciatica, right? From the back to the leg. So a real one is very distinct and the patient tells you exactly what he's feeling. So from that sentence alone, you can stop and ask for imaging because it's there. Now I can talk to him for half an hour about the sport, what he has done, all this stuff, but it doesn't really matter. What matters now is what has been done so far. I mean, it's been since October. We want to know what has been done. So as a doctor, if I know he had had some nerve blocks, injections, corticosteroids, and then the next question would be, did it help? If I want to ask, have you been under the knife? I need to know this, right? You know what I mean? So let's stop here and check the images because it's very. It's an impinged nerve, the L5 nerve. It's quite there. Now we need to see what we can do and what the problems are. Can you all see everything?
I have got screenshots.
Do we care about this circle?
Yeah.
Yeah.
Sure, of course.
Where is that? Anterior or posterior to the spine?
Anterior.
Why do you care about the anterior part?
Oh, it's not.
Won't give anything.
Oh, that's
Anyway, what's the
anterior,
thing?
yeah.
Not
Not
posterior.
pinch nerve.
So whoever was
It's on
showing
there.
him this, that
So
has
that's
no
posterior.
clinical relevance.
Yeah, I see it.
Okay?
Yeah.
Now that this is
Yeah.
important.
Can you zoom it there? Yeah, I can be more better.
Alright, so he gave me L5 symptoms, right? Now we have an L4, L5. I do expect an L4 nerve to be compressed. Remember? Underneath, it's an L4, L5.
That's all for.
L5 is underneath.
Find this one.
So if it's coming at punching out about before you be hitting the nerve.
Oh, it's under L4.
L4. L4 leaves, the L4 nerve leaves the under the L4 vertebra. True?
Yes.
True.
Yeah.
But he has L5.
So it's more central.
Bingo. Okay, so most of it is not a foraminal disc herniation, it's paracentral, affecting the nerve which is going down and not exiting that level. Let's see. Any axial? That's it. I want the axial, the one which is cut this way. Yeah, I mean this one here.
How did you know it was more central?
I think they're just screenshots.
Yes.
Because of the
There's-
pathway, as Henry showed us there, all the lines coming
What I
on.
need is
It needs to get into the actual
this one.
The nerve for L4
yeah. All right.
comes out.
Perfect. Let's see the axial.
It's 4, 5. It's not that one. So it's the next one down, so it's more central. It's going down to 5.
All right. You see it? So it's paracentral, as you said, affecting the L5 and not the L4. If it had been more lateral, it's the left side, huh? Yeah. If it had been more lateral, it would be in the L4.
Can you point it out to us up there? Just so.
That's that ball here.
Yeah.
That if it was here, it would have been the L4 because the nerve of the L4 leaves here.
Okay.
The L5 goes here and goes out from the level below.
Mm.
All right, so science makes sense. Now you enjoy MRI. Now you enjoy symptoms.
So it's coming more straight back central and you get more into the spinal.
Sorry.
You're coming back central now. Rather than coming back here. It's coming back more central, will that be right? You get more into the spinal now.
Yeah. That is a spinal canal here. That's a spinal canal.
Yeah, that's what I'm saying. Most times the disc is going off laterally, it's hitting in there, or if it's coming this
We
way.
have two nerves. We have nerve that leaving here. That's the L4. L5, S1. S2, S3, S4, S5.
What I'm thinking is that it's coming more this way, it's going to give it towards the nose, because it's coming back onto the spinal. Spine, am I right now? Yeah.
I'm not getting it.
So, if the disc is coming more post the
Slow release
4 or 5.
anti-inflammatory.
The nerve
What is
L5
it?
under the one.
Norepinephrine and
Even though the disc is between 4 and 5.
That's it. That's what you know. So you like that with 3 weeks?
Everything in yellow is spinal canal.
Yeah, and before that, it was coming and going.
well, before that Darren treated me.
Okay.
So up to about 8 sessions with Darren and
Acupuncture, like dry needling.
yeah, I completely
Went away.
it was pain free. Now I know
Yeah.
that
Because
yeah, it
the
was
spinal
pain free.
cord
but,
ends at L1.
you know, it hadn't hit.
Below L1 there's no spinal
Yeah.
cord, so it's
You
not
know, we went back to the gym. I went
That's
back
why you
to
see the
training.
You went mad.
Like
You were like a reborn.
circulation is here.
That's where's the
Affecting
doctor?
the nerve.
Oh, just gone.
You know where So now we need to understand. So now what do? We need to think, can we work on him, or what's the best advice I would be giving him? So we go back to your point. What has been done so far? What advice has he had so far? How did the symptoms develop since the MRI, which was done
Last Wednesday.
this week? First time?
Mm. So from January, Darren was treating me. So I've done maybe 8, 9 sessions with Darren, and the pain went completely. You know, after about 5, 6 sessions, you know, it was literally pain free, and then a couple of sessions and felt great, and went back training, you know, and then 3 weeks ago, 4 weeks ago, I in the gym picked up a light dumbbell with my right hand, turned left, and that was it.
Mm.
That was it. It was just.
So how was the pain before that incident happened?
On a scale of 1 to 10, probably 2 would get.
Was it the same? Was it going down the leg?
I wasn't going as far,
Was it the outer side?
so it was still the glute, the hamstring, the glute, the hamstring, and the odd time it goes as far as there.
Okay. And what has been done after the MRI?
So since the MRI, which was this week, Darren treated me.
Alright. Okay, take off your shoes and lie on your back. Is it possible to lie on your back?
Probably not, but I'll try.
So you're not considering red flag?
Oh, I am.
Okay,
But I need to make sure there's weakness or there's numbness.
okay.
Alright, just as much as you can. Alright, just to be comfortable.
His head is off the
Any,
end.
difference in, you know what? You can sit up if it's better for you. Alright, just check one. You're good? I mean, relatively good. Do you feel the same here and here?
No,
That's numb.
that's not.
Here,
I can feel it, but
that's better.
that's better.
Now, how about here?
It's okay.
It's okay.
Yeah.
Okay. S1 would feel different here. Is it same here?
No,
What?
it's different on the left.
That's worse.
Yeah, the left side is.
So now let's now it's there, right? Now I'm thinking of surgery or not surgery. That's where I am right now. Surgery or not surgery, it depends on the weakness, muscle strength. Okay? So an L5 will do what? No, it's a drop foot, right? So we need to see if he has a dorsiflexion, which is good. So point your toes up, all the way up. You all see that?
Yeah.
Press up. Toe up. Toe.
That's it.
Why? It's
good.
so that's around 3 or 2. Can you walk, please?
So I can what are you actually seeing there when you're doing those
Look at him walking. Look at his leg. Why is he walking this way? Is it pain, you think?
No.
No
Can't
power in the
feel it.
toe, big
No.
toe.
So what's happening? He has drop foot.
Is that cauda equinox?
Come here, come here. Come here.
So
So, can you please come back again? Now I want you to look at his feet. Can you walk here, this way? So this is a case that, this is a big red flag. Not the MRI, this. Look at his toes. Okay, he has drop foot. Like he cannot really. So can you stand on your heels? I know you can. I'm just. You see, look at this weakness. Okay, let go. Can you do that with the other one?
Right.
Yeah. That's normal and that's not normal. That's surgical indication.
Is it cauda equinox?
Drop foot. The foot is not being able to go up.
Is that
Yeah, the compression is quite bad.
Oh, okay.
Okay? Here's something that I would operate on. Yeah. It's not a big surgery. It's a really small surgery. So just for you to guys understand, I don't want anybody to be a hero now and try to crack him up. Okay? Even without an MRI, seeing this is what I said by motor weakness, and that's 3 as max. A 2 would be something that would look much worse. So if that's a good grade, I would put a 3 out of 5. It's in the grading system that you asked me about. Given the numbness, given the precise description of his nerve, given the MRI, given the drop foot, I can go and do reflexes, but it won't add any more information. I got all the information I need. Now, forget everybody here, forget therapy. I'm going to tell you as a surgeon now. You might get people who want to inject cortisone, people who want to do a nerve block. That would be just treating pain. You will seem fit, you're young. If you wait and start to think of the time that would come to decide for surgery, you will get back 70% of your strength back. Because the nerve has very bad potential of healing. The longer you wait on a compressed nerve, the worse is the prognosis of that nerve after I remove or somebody removes the disc off it. You get me? So usually in
Not
Germany,
really.
somebody like
Not
you would
really.
be under the knife within a week.
Right. And at the moment, I'm trying to source cortisone injections.
That would give you less pain.
That's what
Yeah, but
and slip.
No, you can get the injection done, but you should also sort out somebody who would operate on you, not because of pain. So I'm not dealing with pain. Pain, you've seen people with pain. I don't care about pain. Numbness is something I accept. I have a numb thigh myself, with a disc which is worse than this, but I never had weakness. So weakness is the only factor that, I mean, per book, per textbook, per law, weakness is the only indication for surgery, because pain is something we can get over with injection, with painkillers. We can wait on it. Weakness is a sign that the nerve is compressed to a certain level that is you're choking the nerve. And a nerve is one of the worst tissues that heal. Not like skin or muscle or bone, they heal in 6 weeks. Nerves don't. I'm not sure how long has it been going on, this weakness. We're talking about weeks now.
4 weeks.
Yeah, you should see if you don't want to get operated on today or tomorrow or this week, you can get the injection done. The injection would kind of loosen up the swelling on that nerve, which gives the nerve to breathe a bit more. But after the injection, if you don't get the full strength, go for surgery. So I would go for somebody who would inject me and a surgeon. The injection will get you pain-free or less pain, but I don't think you get strength back. If you don't get the strength back, go for surgery. You're way overdue. 4 weeks are a lot. Okay?
What happens the longer he would delay the surgery?
The nerve, so if we do a surgery after a few weeks, we most probably get back the full strength in 3 months after surgery. The longer we wait for surgery, we might get back 90% or 80%.
Okay.
And for someone like him, that's a lot. So we're not talking about a 55-year-old person who would be fine with 90% strength.
Yeah.
I was talking, you're his partner, aren't you? And like that, they were told they have to wait about 12 weeks for even the cortisone injection. They're going to Spain and he's trying to get one on Tuesday. Like, that's the system we have here.
Surgically, he could be waiting a year.
Here, yeah.
Even private? Even private?
Yeah.
Even private.
Yeah.
We've already looked. I rang 35 clinics.
They're going to Spain for cortisone injection. Like, that's mental.
Just fly to Lebanon to the good doctor.
There was a holiday booked
But
for next Monday.
There's
isn't there a way that you show up in
there's
the
a
ER?
way to get surgery in Spain. So there's a system, if you say to your doctor that we are referring people over to Spain, what happens is you have to pay first and then claim it back when you come back.
I don't get it. Back in Germany, when somebody like you would show up, you'd be on the surgical plan. I've been in Germany for 15 years, and somebody like you, I would operate in 3 days. 3 days max. I'd also come on the weekend to operate on you. This is how strict we are with mortar weakness. Back in India, they used to do that after a month, the surgery, but in Germany it's 3 days to 1 week. I'm not sure how the system is here.
Just sorry to tell you.
Yeah, right? From supporter.
The surgery itself is not a big thing.
It's okay.
I'm very honest. It's not definitely extruded. It's a small incision.
Fizzy, is it?
You don't want to remove that. Anything is better than using strength. I would have worked on you if I just had numbness.
Yeah.
But the weakness is real. And that's what I'm worried about. Okay? Now you realize the difference between a real red flag, that's a real red flag. Okay? And the other patient before, that was somebody we could work on.
Yeah.
Even though she had a relatively big disc herniation, same of 5S1 she had, maybe? Yeah, was it a 5S1?
Yeah.
He's in F4, F5, but similar. I mean, it's a similar case, right? But completely different spectrum.
So just say we were all ignorant here and we said, yeah, get up there and then we start cracking. Like what?
For him.
Yeah.
You can get it worse.
Yeah. Okay.
So the thing is, the nerve is already compressed. So I would put the left side theoretically downwards and open. Okay. Now, what am I changing here?
Yeah.
I never tried it this way. If I hadn't seen motor weakness, I would have done it.
Okay.
Because I had a I had a spectrum of like a room for error. You get me? He's at that level where he's in the worst case of impingement. There's no room for error here. So why risk it?
Yeah.
Pain, I mean irritation, pain, tingling, numbness, weakness. There's room for error, but once it's weakness, grade 3, not even grade 4 or 5, there's no room for error. So anything I do might cause some spasm somewhere, right? Might cause some more impingement, but there's no room for error. So
Just for context, I haven't adjusted them. So when I trade them,
Yeah.
use needles and class 4 laser just to try and reduce pain.
but even if he had done it before having the weakness, he could not have made it worse. I think it's whatever you did in the. So you felt at one point it got worse now.
Yeah,
Yeah.
it was like instant.
So maybe he did have a
That
tear.
was, I'd say, the one with the talk.
He might have had a tear somewhere, and whatever he did, that could be as bad as even pneumonia, causing him to cough a lot, increasing his pressure. Anything might have happened, and everything is pulled off. You see this, like it's over the cliff, it's pulled down. We still have white structure, so it's kind of new. So this is quite something new. Now the injections might help you with the inflammation. So once you squeeze something, it gets inflamed. Inflammation takes up more space, making things even worse. Now cortisone removes the inflammation, leaving the nerve to breathe, giving a chance to go from 3 out of 5 to 4 out of 5, which is better. Then he has more time for surgery. But if not, then if it stays with the 3 out of 5 weakness, then we might have to go surgery earlier. What injection are you taking, epidural or nerve block?
Nothing at the moment. So it's wherever it can be. It's wherever they offer.
Okay.
It's wherever they come back with
There
the
hasn't,
quickest.
there hasn't been any suggestions. Mark got his MRI
Tuesday or Wednesday. Yeah.
see me Wednesday, and there's no even report as of yet. This is just from what I've looked at, just on the phone. So
I would go for an epidural.
there's been no follow up with his GP or anyone as of yet.
Is that hard to get into?
Yeah.
With an indication from the doctor, it still wouldn't.
No, so I spoke to the GP on Friday. He will do the referral letter for anywhere we want. I rang 35 clinics on all 4 or 5 hospitals, including orthopedics. Even if we go private, we're waiting 12 weeks to see somebody, so they won't give them anything without seeing them.
And
Yeah.
then they want us to say consultant first
Yeah.
before
then
they
give it
will
an injection.
administrate an injection.
Why don't you go see a pain therapist?
Also tried that too.
Because orthopedic will not get you anywhere if
No.
you are insisting on an injection. They don't do those. Pain therapists, anesthesiologists do those.
Tried that too. So we're already booked to go to Spain. We booked it in January, so I contacted Spinal Surgeons.
In what? Sorry?
We booked
January?
it on holiday.
On a holiday.
Holiday in January.
It
no.
just
Coincides.